What is the approach with gap workflow? What are the attributes of that approach that are going to allow today's healthcare organization to more easily overcome those challenges? So one, it has to be a solution that does not require a huge threshold to install and configure. So it has to be quick and easy to deploy. It has to be a quick win for the organization in order for them to realize the benefits of it. It has to provide integration options to multiple applications to provide the ability to aggregate that data and bring it together in a way that's useful to end users and administrators. It has to be somewhat familiar for the end users. They have to, again, we can't adopt technology that has a huge training curve to it that's going to slow adoption or make the end solution unusable. It has to be a solution that's scalable. So both in terms of adding users to that solution, but also as the organization finds opportunities to leverage that platform into other processes or departments. As Jordan spoke to earlier, it has to be flexible. So as we implement technology, we often find that what we find after go live is a little bit different than what we were originally intending during the planning phase. So the solution has to be really flexible to adapt to that, both when that happens, but also as outside forces require changes to the process. We also need visibility. All this data that we're collecting electronically, we have to be able to use that and leverage that to improve the process. So reporting is very important. So every solution should have the ability to report or at least export that data to some type of reporting platform where you can leverage the data. And finally, it has to be enterprise approach. There's lots of solutions out there that address specific problems. But healthcare, and specifically hospitals, don't have a huge opportunity to go out and adopt or buy all those different solutions. They need one solution that's going to be able to address a majority of their issues.
Yeah, and really, just to add to that, something that can complement an existing infrastructure. So whether your organization has chosen a best-of-breed approach or whether you've chosen kind of a single vendor or single platform type approach, a gap workflow solution is one that can help align the systems, processes, and people and really focus on identifying opportunities to fill in any chinks that may exist in that armor and kind of close the loop on any gaps that exist in those other systems.
So, one of the things that we talk about is the enterprise workflow, and this is kind of the preface to what we're talking about with that gap workflow solution. It has to be a platform that I can plug into, maybe opportunistically as I find them or as I come on those gaps, any department within the hospital, whether that's clinical in nature or more administrative back office type functions. So we want to